Medicare Part D. What does that mean? And what do you need to know about Medicare Part D? And why is it so important? In this episode, we have a Medicare specialist, Sean Southard, who explains it in detail. You need to listen all the way to the end.
We hope you've been enjoying all the episodes from Secure Your Retirement. If you'd like to keep learning and receiving these episodes, hit the subscribe button and the bell so you receive alerts when they come out. We've helped thousands of listeners get on the path to securing their retirement. Now it's your turn. Let's dive in.
Welcome, everyone, to Secure Your Retirement. Today is an episode I think is going to be very, very beneficial, and Merce and I are very happy to have Sean Southard. He's a regular now on the Secure Your Retirement podcast, and he's our Medicare guru. So, Sean, thank you so much for coming back on the podcast today and helping us with this very, very easy to understand, non-complicated topic of Medicare.
Well, as always, thank you guys for having me on the show. It's a pleasure to be here, and look forward to talking with you guys today.
Excellent. Well, I was being a little bit sarcastic in my statement. Medicare, I think, is probably one of the most, complicated things to think through, and I think what makes it complicated in a lot of ways is that there's rules that change. There's scenarios that might be very right for one person and very wrong for another person. Today we were talking to a person, and they said, "Hey, I just got through talking to Sean, and we thought we were going to go do this one thing because we thought it was the right thing to do because they had coverage that could be through their employer." They said, "But Sean really helped us to appreciate that might not be the best scenario for us." So, and I mean, what I thought would have been a simple answer was not a simple answer. So today, Sean, what we're going to ask you to talk a little bit about is the different things that we need to know about Medicare Part D and the changes as well as your employer health coverage. But before I get into this too far, I want to talk to you about the changes, but just so the audience is with us, because I think this A, B, C, D, E, F, G stuff gets us complicated. Could you do a nice little just first thing here? What are we even talking about when we say Medicare Part D?
Right. Well, Medicare Part D is part of the alphabet soup. It's D for drug, prescription drug coverage. It's the prescription drug coverage of Medicare, known as Part D.
Okay, excellent. So it's dealing with specifically medications or drugs that we would take to help us as we're dealing with different sicknesses.
That's correct. It's the scripted stuff that doctors would write scripts for, and you would get filled, either at a brick and mortar pharmacy or a mail order pharmacy.
Okay, great. So now that we know D is really for drug and getting all those things to take care of us, what's going on with Medicare Part D here in 2025, and why is it so important that we're talking about it?
So the changes that are occurring have been coming out of the Inflation Reduction Act of 2022 over the last couple of years. The biggest change just occurred on January 1st of 2025 this year. Part D, the biggest change there is the maximum out of pocket that people pay for prescription drugs dropped from $8,000 down to $2,000 per year, which is bringing some great relief to Medicare beneficiaries now with their prescription drugs in Medicare. So that's really great news. But that change has also made the Medicare standard stronger than before, than ever. So what's happening is employer plans, people who are still working and they're approaching 65, getting their prescription drug coverage through their employer plan, they may find out that the employer plan drug plan may not be credible for Medicare's purposes moving forward.
All right. So I always love whenever terms are said, like, Part D, and now you just talked about this other term, talking about creditable. And I'm thinking, well, what is creditable coverage, and why does that even matter? Like, what does that mean?
Right. Well, I know Creditable is a tough one. It's a tough one to spell for sure, isn't it? And the spelling bees, it's a tough one. People always forget the T on that one. But creditable coverage, basically what it is, what it means very simply, is that if your employer prescription drug plan is credible in the eyes of Medicare, that means that it pays as much, if not better, than the drug plans in Medicare, actuarially speaking. But with these changes that have occurred with the Part D Medicare plans, some of the, not all, but some of the employer plans that are offered with the prescription drug coverage, they may not pay as well and or better than Medicare plans. So if that is the case, that means that your employer plan is not going to be credible for prescription drug coverage. It's most likely still going to be credible for the medical components, just not the prescription drug components. So this is why it really matters if you do find out or get a letter that your plan at work is not credible for the drug coverage. You only have 63 days to get enrolled into a credible drug program with Medicare to avoid a permanent lifetime penalty, late enrollment penalty for Part D.
Okay, so I guess before this change here in 2025, Sean, it was like in most cases, it sounded like it would have been a no-brainer if you're working past 65 to stay fully on the employer-sponsored healthcare plan, because usually the benefits are slightly better than what Medicare was providing. Now with this change, it's not as much of a no-brainer, is kind of what I'm hearing, and that there's some nuances that may make it better or more advantageous to get on Medicare when you thought you were going to stay on the employee plan. Is that kind of what I'm hearing?
Yes, there's a lot of truth in that, Mers. Before it was pretty much autopilot, no brainer. Yeah, you're working past 65, just stay on the employer-based coverages and you're going to be good until you retire. Now, with this change, especially, that could prove to be otherwise. It may be more advantageous for you to really look into getting into Medicare, but each case is going to be separate and unique to the individual and their families and their situations.
Yeah, so it seems like it revolves around this word of creditable. So how does someone know if the plan that they're on is still creditable?
So how you're going to know, that's a great question, Mers, is luckily you don't have to guess. Your employer is required by law to inform you and to tell you about it. So every year around October 15, you would get a letter or an email from your human resources department letting you know whether the current plan is credible or not. And here's some buzzwords that may come through. So it may be called credible coverage notice you may receive, or it may be called the Medicare drug coverage letter, or even Part D notice of credible coverage. So it could come under any one of those titles, but basically the gist is they're informing you officially that about the credibility or the non-credibility of the prescription drug coverage. So if you're over 65 and eligible for Medicare, 65 is still the magic number for that, and your notice from HR says that the plan is not credible, then you're going to need to act rather quickly to avoid that late enrollment penalty with Medicare and getting enrolled. Yeah.
So a quick clarification question. The 63 days that you mentioned earlier, is that 63 days from getting that notice from your HR? Because they may send them all out at different times, or is there a rule there?
Yeah, no, that's a great question too. It's when the plan, because basically they're going to be letting you know with open enrollment, right? When the new plan is going to start. That's generally what they're going to be doing. So when your plan year ends and the new one begins, that's when you're really going to need that 63 day. You got 63 days from that point. There probably will be, just like with everything, you may find out the employer may find out that their prescription drug coverage is not credible for Medicare mid-year, in between the policy years, and that's where it could get a little tricky for people because if they find out in March that it's not credible and you get that notice, it's going to be 63 days because that's going to be immediate. It's be, hey, our coverage isn't incredible anymore. But hopefully most of the scenarios will play out where the plan's going to be ending and the new one's going to be beginning. So it's kind of a smoother transition for people there.
All right. So we talked about all these notices. So what do I do if I get one of these non-creditable notices from one of these resources that you talked about?
Right. Well, basically, what you're going to want to do is enroll in Part D as quickly as possible. You can, if you are approaching 65, this is probably the best case scenario is that you're not 65 yet, you're approaching 65, and you're getting these notices. You can enroll into Medicare Part D during your initial enrollment period, which is the 3 months before you turn 65, the month you turn, and the 3 months after. That's the initial enrollment period. Or you can, if it's time, usually group benefits will have open enrollment during the fall, which coincides with Medicare's open enrollment in the fall, October 15th to December 7th. And if that were the case, then you can, go ahead and enroll there during that time period, and or uh, Medicare is allowing a special enrollment period called an SEP. If the plan is found out to, if the employer plan is found out not to be credible, you can use a 60-day special enrollment period to get yourself enrolled into one of the Part D Medicare plans. But the big gist here, the big point is make sure that you avoid that 63-day gap in coverage, because that's the trigger for the late enrollment penalty to start accruing. And basically that we haven't mentioned it, but the penalty, just so our listeners know, on Part D is 1% for every month that you go not being enrolled in a Part D plan when you are supposed to be. And then that percentage, whatever ends up being, is charged against the national base premium for Medicare drug plans, which in 2025 is $36.78. So to be practical there, if you went a whole year not being in Part D when you were supposed to be, you'd have a 12% penalty, which is lifetime, and that would be set against that $36.78, which ends up being $4.41 a month. So that's what your penalty would actually be, is $4.41 a month on top of any premiums that you have for your plan, but that's lifetime. It's going to be charged for the remainder of your years.
Right. Yeah, definitely a penalty we want to try to avoid. When we were talking before uh, recording this episode, you mentioned that, and you said it here on the episode too, that it's a kind of a case by case basis, and you've already had some conversations with clients that know that they're going to be impacted by this change. But you did mention there's an evaluation here if someone's utilizing an HSA through their employer plan. So uh, let's talk more about that and what that really means as far as the decisions people have to make if they're using an HSA.
Sure. And I had a couple of cases this year. People call in to let me know that this is happening, and they're very confused and so forth. A couple of folks did not contribute to an HSA, and a couple did. So HSAs are health savings accounts. They're allowed, the IRS allows those for people that are enrolled in high deductible health plans, HDHPs. And they're a wonderful tool to help people save money for qualified medical expenses. And they're also a really great tool for retirement purposes as well. In 2025, the IRS sets the limits, of course. The IRS allows a person to, if they're making a family contribution, if they're enrolled in HSA as a family and contributing as a family, they can put in $8,550 for 2025, and they can put in an extra $1,000 as a catch-up if you're 55 years or older. So basically get almost $10,000 in there, money that's going in tax deferred and growing tax deferred, and can be used tax-free when used for qualified medical expenses. So people who are contributing to an HSA at work and they get a notice that their prescription drug plan is not going to be credible forthcoming on their plan, they really need to, as a case-by-case basis, really figure out and sit down with someone like me and possibly their tax guru or their tax person, and figure out if it's going to be worth and getting into a Part D plan and avoiding that late enrollment penalty. Because if you're going to work another 2 years and you were going to contribute the max into your HSA, that's almost $20,000 over 2 years. Yes, there's going to be some penalties there by the IRS for excess contributions. They're going to make those contributions taxable, and any interest that's gained is going to be taxable with a 6% excise tax on top. But you need to figure out what that is versus what your penalty in Part D is going to be, because it actually, in the end, it may work out, well, even though I'm going to get penalized for excess contributions, it makes more sense to keep contributing my HSA and not get enrolled in a Part D plan right now. Because we didn't mention, but in order to enroll in Part D prescription drug plan with Medicare, you have to be at least enrolled in Part A of Medicare, which is the hospital coverage. And that would say to the IRS, well, you are enrolled in Medicare now, you're not allowed to contribute to your HSA anymore. So it's just a case-by-case basis. You really need to think some of these things through and take a look at it if and when you do get those letters of non-credibility for your prescription drug coverage at work.
So, Sean, if somebody's listening to this right now and it's like, okay, we're kind of going through all these, topics and trying to, again, talk about something that sounds somewhat complicated. What if we had to just sum this up? What should somebody do right now? If you're in this phase of life where this might be a situation that I got to think about.
Yeah. Well, first of all, just always keep it simple, right? So just if you're approaching 65 or you are 65 and you're still working, just be vigilant now and be looking out for that credible coverage notice that can come to you either an email or by letter. Be proactive, call the HR department and say, hey, I heard this podcast or I heard some things and about this topic, and I wanted to know if you guys know at this point, is the prescription drug coverage credible or not, or going to be in our next plan year. So kind of try to find that out. Start comparing drug costs, if you can, to your current plan to maybe one in Medicare. And of course, if you do and you decide to do enroll in Part D, call me. I've been doing this for a long time. I know a little bit about a little bit, as they say, and I can get you answers that you're going to need and help you get to where you need to be as well with the process. So call me, contact me, and give me a call, and I can help you.
Awesome. Well, thanks a lot, Sean, for bringing some clarity to a very tricky subject. That's why we love having you here in our office. Because we know you have some very meaningful conversations and help people make decisions around Medicare, not just Part D, but everything from that A, B, C, D to, the Medigaps and everything. So thanks for carving out some time and hanging out with us. We really do appreciate it.
Oh, thank you. I always appreciate you guys having me on, and it's always a good time. So thank you so much.
We hope you have enjoyed this episode of Secure Your Retirement. If you would like to learn more, we have actually created an online course called 3 Keys to Secure Your Retirement. This video course helps you to think through all the different steps as you get ready to plan for and live throughout retirement. You can access this by going to our website, pomwealth.net. In addition, you can also subscribe below to our podcast called Secure Your Retirement.
For more retirement tips, check out these videos. Also, if you find them valuable, please subscribe to our YouTube channel and give us a like.